Welcome to Conversations About Care with Texas Oncology, a video series highlighting prominent topics on cancer care right here in our community. I'm pleased to be joined today by a panel of incredible physicians right here in Austin. If you can just start by introducing yourself and telling us a little bit about your role within Texas Oncology. We'll start over here, Dr. Herman.
I'm Dr. Mike Herman. I'm a radiation oncologist.
I'm Dr. Heather King. I'm a breast surgical oncologist and oncoplastic surgeon.
I'm Dr. Rebecca Viatric. I am a surgical oncologist.
And I'm Dr. Jeff Iorio. I'm a medical oncologist.
All right, well, thank you all for being here. I know Texas Oncology has a very unique approach to providing individualized patient experiences and comprehensive care with multidisciplinary care teams. How does this approach differentiate Texas Oncology from its competitors?
Well, our organization is formed by physicians from multiple specialties. So we have medical oncology, we have surgeons, we have radiation oncology, we have gynecologic oncology. And so those are the disciplines who come together to take care of each patient who's diagnosed with cancer. And then we've also created this network to surround that patient with other physicians such as palliative care. We provide physical therapy, nutrition, social work services.
And the collaboration with the physicians in our group is so nice because evidence is changing all the time, new data is coming out, people go to different meetings and learn a different technique. And by working together with people, not only in your own specialty, but other specialties, we're able to bring that frontline care, the new gold standard to patients on a day-to-day basis.
So people hear holistic care all the time. How would you explain holistic care to someone?
I mean, I look at holistic patient care as, you're not only taking care of the physical individual, but you're really leaning on the emotional, spiritual, and social part of a person as they're going through any of these diagnoses and journeys. And so we spend 10 to 15 years of our life learning everything we need to know about how to take care of a certain disease. And once you start meeting patients in the clinic on a day-to-day basis, you realize that that figure you memorized on page 86 for that test somehow doesn't mean as much as it does when you talk about how does a family now handle this diagnosis, what is it like for that young mom who has young kids at home to get diagnosed with this cancer, how can we help her in that situation, how can we make this a better experience as they go along this journey.
And the way I see it is you've got that medical component where we've, as Dr. Herman says, we've trained our whole lives trying to focus on that, but cancer brings this whole other emotional and social component to it that I think that we try to address a lot, and part of that's having clinics that are spread out throughout our communities.
So where's all this going? What do you see as the future of this comprehensive patient care?
And I think it's more personalized for the patient with all of the new science and looking at their tumor specifically and being able to give them the drugs that work and whether or not they're surgical candidates that may extend their life. And I think some people feel like if we can just take it out, it's going to be cured. I was like, that's just a piece of it. I would love to think that what I did is all that needed to be done, but that's really just not true. And so being able to do all of this and extending out their life, I've seen stage 4 patients be there many, many years later, swim with whales, do all this stuff on their list that they wanted to do, and have a really great quality of life throughout that period of time. And that has been the most rewarding to watch with the science and being able to personalize it and see your patients get to those goals that they had before they were diagnosed.
The concept that because a cancer started in the lung or the breast or the bone, that you treat it in one particular way, that concept has changed in the past few years, and now we understand and do all this mutational testing and to drive the medications. And there's a huge trial, this was in 20. Now women with triple negative breast cancers, if they have a BRCA mutation, they get specific drugs. And so sometimes people are like, why do I need genetic testing? I'm like, well, at this point it's gonna drive the medications, and we know that improves your survival. And so getting down to the genomics of the tumor is so exciting to me, and how much more personal can you get? Is like to the DNA of the tumor, treat that, and then take this patient through to a survivor. And then that's why all this comprehensive care is important, because they're going to live after this diagnosis. Many more people are gonna survive.
We talked about the amazing staff, the doctors, the nurses, just every member of the staff. What other resources and support systems are available to give patients that more holistic experience?
I'll say in our community in Austin, there is a really good network of kind of these groups that have formed through time, whether that's things like Wonders and Worries, which is a great resource for people with young kids and being able to relate their difficult diagnosis with those young kids, whether it's things like the Flatwater Foundation, who are providing mental health services for family and friends and patients. Breast Cancer Resource Center is an amazing organization here in town that really helps try to connect patients with that community, and countless others that unfortunately I didn't name, but that are homegrown through this city and are quite amazing.
All right. Well, thank you all. Thank you for your time, Dr. Yorio, Dr. Beatrick, Dr. King, Dr. Herman. We appreciate you all for joining us for this conversations about care. Of course, to learn more about the holistic experience provided at Texas Oncology, you can visit us online at texasoncology.com.